Thank you all for joining me to have this conversation around ground up economic development in rural communities from a variety of perspectives. And as we get started, I'd really love to have each of you introduce yourselves and share a little bit about your organization and your background. And tell me how the work you do connects to rural economic development as a way of getting to know one another. And I'm just going to go across my screen in the order that I see you, and then we don't have to have the whole conversation be ordered. We can be a little more free flowing after that. And would you be willing to introduce yourself for us?
Sure. Thanks, Annie. My name's Anne McSweeney. I'm the Director of National Initiatives for an organization called First Children's Finance. First Children's Finance is a community development financial institution, a CDFI, and a national nonprofit that focuses on supporting childcare as a small business. Um, and we do that in a way that is inclusive of both for-profit and nonprofit childcare programs and programs that take place in homes, all the way up to large centers and chains. We have staff across the country, although sort of focused in the Midwest, that work directly with childcare business owners and provide training and budgeting, financial projections, kind of one-on-one support on back office operations for childcare businesses. We also work with communities to more deeply understand the childcare needs and the assets that that community brings to come up with local childcare supply solutions. And then the work that I lead is more focused on federal, state, tribe, and large municipality systems solutions. So helping childcare systems leaders think through how are they licensing childcare, how are they funding childcare, how are they supporting childcare in a way that is either hindering or advancing childcare supply in their community. I think the reason I likely was invited to this conversation is an initiative that our organization has been running for about a decade now, called the Rural Childcare Innovation Program, which started in Minnesota and now we've conducted across several states. But that is a technical assistance um, service that we provide to communities to more deeply understand the childcare supply that they have and then what parents are saying that they need, and do a planning process that usually takes about 2 years to identify community assets. So that could be childcare programs that are already existing, that want to expand, providers that are operating maybe informally that are interested in becoming licensed, employers or community facilities that could offer at cost or below cost facilities to expand childcare, employers that are willing to contribute in a number of different ways. Really, it runs the gamut on kind of what that local solution ends up looking like, which I think is a big thing I want to bring up in this conversation. But we take the learnings that come out of that and work with state leaders in states with large rural communities to think through kind of state level policy as well that could support childcare businesses. We know that childcare access is an issue across America and it's more pervasive in rural communities. An imperfect way of thinking about that is childcare deserts, areas where there's only one childcare slot for every 3 children who are of childcare age, which I think, as I said, imperfect, but a good proxy for where parents and families are really struggling to find care. And the majority of rural communities fall into that category. And in fact, a number of rural communities don't have any licensed childcare. So I think there's a big conversation happening in my field right now, in terms of how do we advance childcare policy kind of coming out of COVID funding relief programs, that are all the more important in rural areas where childcare supply has been most limited. But I think there's a lot of opportunity, and I'm excited to have a conversation with Karen and Jacob about it.
Wonderful. Thanks so much for that background and for sharing a little bit more about the Rural Childcare Innovation Program. Karen, I'd love to have you introduce yourself next.
Sure. So I am the director of a regional economic development district on the very rural North Olympic Peninsula in Washington State. We're the very kind of northwest corner of the state where Olympic National Park is located. And in our two-county area, we have a population of about 110,000 scattered across two counties, concentrated in tribal nations. We have seven tribal nations in our two counties, and small towns and cities. Our largest city is, I think, Port Angeles just went over 20,000, and that's our largest community. We're very isolated geographically. You can get to us across the Hood Canal Bridge, which is a floating bridge, and so in bad weather it closes. Or there's a roadway that you can get to us, but it's frequently closed by landslides during bad weather. So we can be pretty cut off. And it's an area that historically was a timber economy, and to a lesser extent a fisheries economy, and everything that goes with that, as the community tries to find kind of new ways to work. So there's been a big loss in timber jobs over time, which I think a lot of the community attributes to environmental regulations, but when you analyze it, a lot of it actually has to do with changes in timberland and timber company ownership and mechanization, as much as it has to do with the regulatory environment, and also just overcutting. So as we've lost those higher paying jobs, what has replaced that is a tourism economy. And if I hear one more federal regulator or one more federal agency promoting recreation tourism as the answer for your rural economy, I think I'm going to scream, because as important as tourism is to the region, what we see is a lot of low wage, part-time and seasonal jobs, and that just is not enough to keep people. We also, like a lot of the country, are struggling with housing availability, and that has been worsened by the tourism economy. So a lot of what used to be small rentals are now Airbnbs. In our wealthiest community, Port Townsend, we have a lot of seasonal residents, and those homes are occupied for, perhaps 5 months of the year, and then either rented out or just empty the rest of the time. And so it's just creating a real burden. We can't move. People can't hire people into the region because there are no homes for sale or for rent. And I have an employee who had been trying to get. She lives just across the county line in another county, and has been trying to relocate since I hired her in April, and has just managed to buy a fixer-upper. So it affects everybody. We just went through the process of a recompete grant application, which I think revealed some of the strong disagreements that remain in the area over what the path forward looks like, and whether it should be ground up, or whether we just need to bring the timber industry back, or what the answers are, and how much of the answer is things like childcare and social supports versus industrial development. So anyway, that's where I am.
Thanks,
Oh, and
Karen. I appreciate you sharing. Go
we
ahead.
also work on climate change and energy resilience as a path forward.
Yeah, I'm glad that you shared that. At the risk of forgetting to do it later, I wanted to also say that two themes that run through all of our work at ruralorganizing.org is climate resilience and racial equity. So to the extent that we can surface those themes in the conversation we have today, I will certainly try to, and will appreciate any comments you have on that as well. All right, Dr. King Brown, I'd love to hear you introduce yourself and share how the work you do on incarceration links to rural economic development.
Sure, yeah, and feel free to call me Jacob too. I'm not that kind of doctor. Um, but So my name is Jacob King Brown. I work at the Vera Institute of Justice. I live here in Brooklyn now, but was born in Arkansas, grew up in around Kansas City, and lived in Colorado for a while before going off to college and stuff. So I've been around in rural spaces and have family in rural spaces, and um, a lot of my work at the Vera Institute has been about trying to understand um, the current state of incarceration. So, like, how have changes in the way that policing and sentencing and drug enforcement and all that shifted things over the years. And so, we've done a lot of data collection and tried to understand that, and been able to find that, like, contrary to probably what most people assume, um, rural communities now have the highest rates of incarceration. And I'm not talking about like they have state prisons in rural towns. I'm talking about the local jails that are holding people arrested by the local cops are now double what they are in the biggest cities in the country. And even though there's, um, roughly half as many people living in rural counties in the US compared to the biggest counties in the center of million plus metro areas, they have roughly the same jail populations. And so that's a real problem. The racial disparities are also worse in rural areas. Um, and so um, my organization started to do some work on this and try to see if we could sort of help direct some reform, criminal justice reform, sort of focus and energy towards rural communities in particular. And so um, as part of that, we started the Inner Backyards Initiative, which was designed around trying to show that incarceration, mass incarceration, is a problem in all of our backyards. It's not just um, something that is in the big cities. And so um, we've, through that, have done a lot of different things. We've done partnerships with local organizations to help them develop like policy agendas around ending criminalization of poverty, dealing with drug use differently, and things like that, as well as supporting reentry and diversion, as well as things like bail reform and stuff like that that like is really needed actually in rural areas. Um, so we've done that, and we've also done some research to try to understand how this big growth in incarceration in rural areas happened. So, what were the coalitions that supported it? What was the like economic conditions or changes in economic conditions that made it possible to where often it wasn't just the sheriff or the police, the sort of like loudest voices in the room about this. It was local economic leaders and people who thought that a bigger jail might mean more economic development somehow. And those analyses have often proved false. And there's plenty of state and local and federal policies to blame on those things. It's not just local people making bad choices. It's the federal government making bad choices about how they're going to handle rural development. And so we could talk, I think, in more detail about some of those things and the research we've done around that. But looking forward to this conversation today.
Yes, thank you for highlighting that link between those both local and federal level decisions and how that links to incarceration as a economic development strategy. And I'm looking forward to hearing more about um, some of the data that you've uncovered. So I'm hoping we can have a bit of a free-flowing conversation from here. Some of the pieces of information that we rely on heavily and to frame our work are the information that shows us that there are stereotypes about rural communities that are really inaccurate, including things around the that rural communities don't need investment. So for one, 8 in 10 rural communities. Um, Sorry, 8 in 10 persistent poverty communities are rural. A quarter of rural residents are people of color. Often people think about rural communities as overwhelmingly white. And in some places that is true, but when you look at rural communities in aggregate, it is not true. And also, people often think of rural communities as primarily agriculture communities, but when you look at workers, 9 in 10 of them make their living outside of agriculture. In addition to that, there are some other pieces of data around that some of you have already shared, and you talked about rural childcare. Um, um, you called it imperfect, so I'm feeling hesitant to use the word, but rural childcare deserts and these places where carceral facilities are being used as economic drivers. And so, as we go into this conversation, I would love to hear what you think are some of the root causes of the disparities in economic systems in rural communities, and any potential low-hanging fruit types of solutions that you might be working on. Maybe that maybe there aren't any, but if there are, I want to make sure we elevate them early and often. And feel free to share any stories or data that you rely on to do the work that you do. And I won't point to anyone, just whoever feels like you have something to say first will be fine.
When we talk about root causes, I mean, there's so many root causes of rural poverty, but I think one of the major root causes, in my opinion, has to do with the methods by which we fund all the services and infrastructure that happen in communities. We are so reliant in this country on property taxes as a means of funding things. Federal programs, require match, and the match is supposed to come from property taxes or local income taxes or whatever. And in a rural area, there just simply is not enough property owned, to cover the costs of a lot of these things. And so, communities that already have that are looking to make change, they just fall further and further behind. And then, there are new regulations around water systems and sewer systems and what needs to happen there. School systems fall apart. Education is underfunded. And so, from the beginning, rural communities are, all of the tax base is going into, just trying to keep basic infrastructure in place, and there's nothing left over for the kinds of social programs or investment in economic development, or investment in people, that can happen in more urban communities, and and rural communities are often extremely tax averse. It's just that's a tremendously challenging problem to address. But I feel like federal investment, state investment could make a difference, but there just is this idea that there always has to be match in the game, and so trying to scrape together, the community's share of funding becomes a real challenge, and that affects everything. That affects housing. That affects economic development. That affects childcare. That affects incarceration. It affects homelessness, drug use, mental health care. All of those things, education. They're just all impacted by this structure by which we finance everything.
I think building off of that, like another kind of way I think that the financing becomes a problem is that often in local economies and sort of local tax dollars, there's this sort of zero sum game about who gets the money. And what we've seen in the last couple of decades has been a sort of undercovered quiet jail boom, is what one of my colleagues calls it, in rural areas. And the consequences of this is that many counties and localities have dedicated a huge share of their kind of capital budget, the money that they have for building new infrastructure, to building a jail. And, it's a 30-year bonding loan process often. And these projects often involve like tripling or quadrupling the size of the jail. and people talk about it as like planning for the future. And often there will be consultants that show some kind of projections about like the jail population going up, and you have to be responsible and everything. But like the truth is, if you change your local policies around, arresting people that have um, mental health issues or drug abuse problems, you often don't need that large of a jail. And, I think another thing that people often don't do is that they see those estimates and they say, oh, we're going from a, 30 bed jail to a 150 bed jail. That doesn't sound that big. But like, if you think about it on a per capita basis, that's like doing something like building three Rikers Islands or something in your community. And I think that that's the um, kind of thing that we, uh, Vera, have been trying to like share as a way to think about these discussions when jail construction comes up and gets on the agenda. It's important to stop that and to pause on those kinds of projects because there's so many other needs in the community that maybe aren't as well organized or don't have as many people backing them at the start, but will meet people's real needs and can help actually secure economic development in a community.
Yeah, I would certainly agree with both Karen and Jacob that how we structure the kind of foundation of how we structure our funding at the federal, state, and community level, it really kind of goes to the very heart of the issue. I think people who are unfamiliar with childcare are often shocked by just how little public money is in the system. It is a public good that is funded through private dollars, through family tuition. We have Head Start and we have childcare subsidies, but they represent truly a very small fraction of the overall childcare industry. So what we have is a patchwork of programs and mostly small businesses offering a service in a fundamentally broken market. And we know through cost studies that we've done within our organization and that other organizations have done that the market is more broken in some places than others. And I think there's an assumption that childcare in rural communities is significantly less expensive because wages are lower, facilities are easier to come by. And we know that's just not true, that it is an incredibly expensive service to provide everywhere. And what differs more is families' ability to pay for it than how much it actually costs to provide. So I'm very excited to hear, discussion of kind of the issues of matches and the issues of how public dollars can really shape conversations that are happening at a local community, because that's, I think, exactly the necessary conversation in childcare as well.
Yeah, and speaking of childcare, Washington State has has a state subsidy program for childcare. But in talking with our childcare leaders in our community, what the state provides per child is less than the cost of providing the service. And so it's great for parents that the cost is subsidized, but there aren't nearly enough slots because it costs more to provide a slot to care for a child than what the state pays. And it's also led to a real imbalance in particularly child care available for infants and toddlers. So as we were preparing for our Recompete grant, we were analyzing the population that is not in the workforce by gender and age and various other factors. And what we found is that in our community, women who have children over the age of 6 are in the job market, are employed at a rate the same as the national average or even slightly above that. Women with children under 6 are out of the workforce at almost 20% less than the national. We have 20% fewer women with children under 6 in the workforce than the national average. And it's mainly because of the child care question. The lack of availability of slots for infants and toddlers because it costs more to provide for infants and toddlers, and it's not affordable. It's not affordable for families to pay for, and the subsidy just doesn't come close to covering the cost. And so, anyway, it's another of those places where, by the government providing funding, you think, oh, this is a great thing, but it's if they're only providing 75% of the cost of care, the rest has to come from somewhere.
And I think that links very closely to what you said about matching requirements and grants, which is this assumption that there is this match pool somewhere to cover these public goods. So I think that there's a link there. I wanted to just kind of raise some of the patterns that I heard in what you said so far, that the structure of the way we fund um, public needs is flawed fundamentally. I heard a couple of things under that heading, that there are public goods, in particular childcare, that are funded privately, and that isn't really working, and that there are inadequate subsidies built into the systems that are intended to keep the childcare industry afloat, for one, and that might carry over to other places. I heard that the funding structure that relies on property taxes it is fundamentally flawed because the math doesn't work, which is a theme I've also heard in the child care industry. It's hard to make the businesses pencil when they're funded through private funding for this public good. And then I also heard this theme of misplaced incentives, that the federal funding is incentivizing economic development through things like prisons, through or jails, and through um, structures that require that match, and through private funding in ways that push people toward a system that is never going to work in the end. Maybe as I'm saying those things out loud, tell me what I might be missing in that theme, or anything you'd like to highlight from your perspective.
One really frustrating thing that we hear frequently on that sort of misplaced incentives track, Annie, is um, in conversations related to workforce development or economic development, community colleges, there are disincentives to support childcare providers or people going into the childcare workforce because it is such low paid work. So apprenticeship programs are just starting to be created for childcare, but for a long time, childcare was precluded from workforce apprenticeship programs because of the low wages of the industry. So you have to, that's a much bigger problem. Obviously, we don't want childcare jobs to be low wage jobs, but when we think about what's perceived as a high wage job, and it's um, you know working in a prison, and a low wage job is working in childcare, that's a big problem.
I don't,
Yeah, and
go
I
ahead,
do
Karen. I'm
think what
sorry. I'm
what there is funding available to do, because if you are a small rural community with no tax base and you're struggling, you're constantly looking at what federal programs are available, and yeah, there might be funding available to expand your jail, but there's not funding available uh, to expand education programs, or there tends to be funding for hard capital kinds of things, and very little funding for anything that's going to be ongoing, anything that requires staffing, so you can't get the money to do drug treatment, to do diversion programs, to do mental health treatment to keep people off the streets, but you can get money to expand the jail so that you can take all those homeless people and have them cycling in and out of the jail and attaching fees every time you do that, fines and fees. Uh, you can't get the funding that's needed to really try to resolve the housing issues. But again, you can get funding to move your homeless population into jails. In our area, people are a little bit more. Most people are a little bit more progressive thinking, so we don't have that issue that people are really trying to, uh, including our police departments. For the most part, are trying not to jail people just for homelessness or mental health issues. But we have a pretty major problem with homelessness that's very visible and on our public pathways and our public parks, with a lot of drug use and a lot of really severe mental illness. Where just walking along the seafront park the other day, I passed one man who's just talking to himself and waving his arms, and he wasn't hurting anybody, but he clearly was having a mental breakdown of some sort. He passed somebody else who was using drugs right there on the public pathway, and I think our communities struggle with what to do about this, and there is a huge outcry from people who are like, I can't take my kids to walk along the shore path because of what happens. There's a lot of opportunity crime, a lot of broken windows downtown, a lot of small arson, that sort of thing, and and so I can see why, given the disincentives, why some community or the incentives, some communities say, well, let's just build a bigger jail and that will solve all of our problems. And there's funding for that. Our sheriff's department has gone after funding for, the having social workers on the police, on the sheriff's staff, and our police department, it's in both Port Townsend and Port Angeles, have social workers who respond with police, and so there is work happening on that. But there are tremendous disincentives for that because you can't get ongoing funding to support it, but you can build a jail. But you can't build a homeless shelter, or you can build the homeless shelter, but you can't operate it because there's no operating money for it.
Yeah,
Um,
yeah, and I think that's one of the things that's, jail projects can, like, there's been this thing we discovered was, or some other folks have also been researching this too, but we wrote about how the USDA, through their rural community facilities um, program, which is designed to support economic development and support community facilities, has ended up spending millions on jail construction in rural areas. And like this was like a program that was designed to support things like homeless shelters or education facilities or health facilities. And there were some sort of entrepreneurial consultants and sheriffs out there that were like, well, this looks like it's money we could use for a jail. And they did. And like the misleading thing about often these projects, especially jail construction projects, is that like over the life of the project, the sticker amount at the beginning is 1/10 of what the cost is to operate the larger facility, and even if it has a low rate on the loan that you're getting from the USDA, like the interest also adds up over time, just like on a mortgage. So I think that keeping that in mind of like these numbers for the projects are a tenth of what they are. You got to multiply them by 10 to get the real community cost, the investment that's happening there is really helpful. Um, and, I think what we have heard people say, and sort of like, I think is kind of obvious, is what, these rural development funds from like the USDA, for instance, there needs to be more funding available for programs and not just the capital costs. And the funding needs to be in the form of grants and not just loans. The loans often, even when they are relatively affordable, are not affordable enough for impoverished rural communities. So I think that's a clear federal policy priority that I would love to see rural organizing pick up and push on. So,
Yeah.
no.
Well, thanks for that specific call out. I think that's helpful, and I think it's very well aligned with some of the policy work we have been doing, and having the specific use cases to point to that is always very, very helpful. I think that you all have been fairly generous about sort of the reasons that rural communities may choose to pursue an avenue like building a jail because of the availability of funds. And I don't think that that's incorrect, but I wonder before we move to another direction if there's any comment you have about the extractive nature of a system that's built on, like you were saying, Karen, you have folks who might be cycling through a local jail, and every time they do, there are fees attached to it. I'm wondering if you have any comments about that, because what we see as a pattern is on a macro level is that rural economies tend to be faced with very extractive systems that extract the people and the wealth from them to other areas. And it feels to me like this may be an example of how some of that is happening on a more localized scale as well. If I'm pushing that too far, please feel free to tell me. But I'm curious if you have any
No,
comments on that.
I, I think I can speak to that somewhat. I mean, the issue of, like fines and fees for court cases and just sort of processing fees when you get locked up in jail. There's so many different ways that jail systems will nickel and dime people, and it's much more than a nickel and dime. It's hundreds and hundreds of dollars. That like if you end up not paying, you get sent back to jail often, and these are modern day debtors' prisons that are operating legally in the United States due to loopholes and lack of enforcement of the Constitution and the sort of straightforward requirements that you shouldn't lock up someone just because they're poor. But like I think that in rural areas, there's another dynamic that we've seen also sort of related to this, and it's this idea of like, extractive. I think is helpful, but like the federal government puts a lot of people who are awaiting trial on a federal criminal case, as well as people that are in some kind of immigration proceeding in local jails on a contract basis. And there's a huge network of local jails, especially in rural communities, that see this as kind of a revenue stream. And so there's about $1.3 billion a year that the federal government is spending on these jail cells for people that like haven't been convicted of a crime, are facing trial, and due to various kind of restrictive federal criminal pretrial rules, like can't be released during their case. And like we see some real pernicious problems when communities start to rely on that money because it aligns local law enforcement with these policies of criminalizing drugs and criminalizing immigrants and sort of gives them a financial incentive to support those kinds of policies at the federal level as well. Um, and the other thing is that these revenue streams are very unstable, just as like charging fines and fees from poor people can be very unstable and actually no, you end up like you're spending more money trying to charge and collect the fees than you are in the fees that you're bringing in. Often people cannot pay, and so you can't squeeze blood from a stone, and you can't always get the fees that you've charged back into the court. And so um, we've seen that the collection of fees often is much lower than people plan or imagine. Their budgets sort of show that, and that when these federal dollars come in for the jail beds, what happens often is one county builds a new jail nearby, and then the feds move the people over to that other new jail and sort of change the contract and stop sending people to your county's jail. And so the money goes away, but now you're stuck with this big jail and you're sort of looking for other ways to kind of use it. And often it ends up that people then start not getting released pre-trial when they should be, or they get held in jail longer. And it's about sort of keeping that jail looking like it's full and looking like it's being used appropriately. And so I think there's some like real, you know, problematic ways that the money stuff in jails and when it gets connected to the criminal justice system often promises to be a solution or some kind of revenue, and it often doesn't pan out that way actually, and is more just revenue sink, the cost. So,
I think it's really important for us to be able to point to that data where it doesn't work, particularly when we see that there is that extractive structure. So I'm grateful for you speaking to that a bit, Jacob. I want to shift gears just a little bit and talk about kind of what are some of the uniting policy trends and what are differentiators. And Karen, you spoke a little bit about kind of what is their funding available to do, and that guides a lot of rural community economic development decision making. A lot of the things we've talked about so far, the funding structures, um, I think are fairly widespread in terms of the rural communities that those issues impact and the potential solutions could impact. I'm wondering if you all could talk a little bit about what you see as some of those um, unifying opportunities and where rural communities are different enough that there might need to be different policy solutions. And just before I stop talking, want to just name that I think we're sort of uh, it seems like we're at the vanguard of using some public funding to invest in some of those social needs, particularly childcare, as one of those avenues. That Karen, you mentioned that your recent application included childcare as a economic development strategy. So I would love to hear a little bit about that as a potential unifying opportunity, or if you feel like that is more particular to certain communities instead of others. But really, any of the unifying opportunities or ways that communities are different and need um, diverse solutions.
Well, I would start with maybe in an obvious place that I think that flexible economic development funding that can be used for things like childcare, that includes technical assistance. I can't imagine that there isn't a rural community or really any community that would benefit um, from those sort of programs. I think where um, just care is needed is um, approaches that bring childcare voices to the table and recognize um, kind of the assets that are already existing in the community. We know that there isn't enough childcare. We want more childcare. We want it to be higher quality, but parents and children and childcare providers are in place and they're offering services and often very good services and um, without their voices at the table, big investments in a child care center or expanded preschool within an elementary program can really destabilize the whole system. So I would advocate for approaches that bring community development folks and child care folks to the table together early and often in planning stages to understand what families really need, what's currently available, and where the gap is in a more thoughtful way. Um, I'm so excited about childcare being part of the economic development conversation, being part of the infrastructure conversation, but really nervous that that lends itself to those big capital projects, big childcare programs on the Hill. But if that childcare center is 100 miles away from you and closes at 5 p.m., it doesn't really do much good for your family. So we really want to make sure that smaller providers, community-based providers who are operating out of their home are valued in economic development conversations, and that requires special outreach approaches, special technical assistance, but I think is really critically important to provide meaningful access to childcare in rural communities.
Yeah, I just want to jump in. I'm sure that Karen has some stuff to say about this too, but I just want to jump in here because what we see it currently introduced in federal legislation around childcare, and specifically rural childcare are a lot of opportunities that are better than nothing, but that primarily focus on those capital investments of childcare facilities. So I'm really glad that you pointed that out, and that while we want to see childcare facilities and make them available through the funding that exists, specifically this USDA Community Facilities Program that Jacob was talking about, we see that like this is the tool we have. So now it's the hammer we have. Now everything looks like a nail, but actually we have some screws and some hex bolts out there, and we need a few other policy solutions from my vantage point. So just wanted to point that out. But I'm sure Karen has some stuff to say about this too.
Yeah, I just want to say a little bit about what happened when we were putting together our recompete proposal, because it was extremely frustrating that the people who were gathered to put it together were all county government and economic development officials, and we knew that child care and social wraparound services needed to be part of the proposal, but somehow no one wanted to convene those folks. They just were wanting to make assumptions and write stuff in. And so what was getting written in for childcare was just vouchers. And I was like, but that does not solve the problem. If there are not enough slots, then then vouchers don't help. And so I was able to, at the very last minute, have a conversation with the leader of our regional YMCA, who has done a lot of work with other child care providers on understanding the issues, and was able to get some operating subsidies written in, specifically targeting, creating some additional slots. But in as we were researching this, talking with the treasurer of the Makah tribe, they had just built a huge new Head Start and child care facility, and Glenn said, we need money to we could serve a lot more children, but we don't have the money for the staff to serve more children. We've got this big, beautiful building, and half of it is empty because there's no operating money. And I think you hear that story over and over again, and not only with childcare, that we build things, but we're very suspicious of paying for staffing. And the other challenge with in the recompete program was, we couldn't do anything around workforce development for childcare providers, which is another huge need, because we had to be targeting a certain level of wage. It was required by the grant. Your investments had to go towards these higher wage jobs, and childcare jobs aren't there. And so so what do we do to raise the wage? Another issue that came up, and this may only be true in Washington, I'm not sure, but the educational requirements for childcare workers in our state are roughly equivalent to the education requirements to work in the schools. But working in the school pays a lot better. And so people may start in childcare, but then they jump, once they've got a little bit of experience, into the school system where they can be paid better. So somehow you have to address that. It's very hard to make childcare pencil as it is, and so programs to try to help small in-home childcare providers get going. You're almost doing a disservice to folks if when you start running the numbers, if they're not going to be able to make it work. Do you want to encourage them to do that, and maybe go into debt and then fail? There's something has to give, and childcare is fundamental to economic development, because people can't work if they don't have childcare. And so we are starting to see a lot of our employers understand that, but they don't know what to do about it. And I heard very clearly from the providers that I talked to, make sure that the employers don't try to start their own childcare, because that just pulls money and resources out of the system. Maybe if they want to pay for slots, or subsidize slots, in existing daycares, that would be helpful. But we don't have mechanisms to talk about. It's a systemic issue. There's the wage issue, there's the cost issue, and we're just underinvested everywhere in the system. And I don't think childcare is the only place where that's true. I think it's true in mental health care. I think it's true in substance abuse. I think there are homelessness. There are just over and over again places where, we're willing to build a building, but we're not willing to cover what it costs to actually make it work.
I want to, can you just, I want to pull on a thread. You mentioned that you were hearing recommendations that folks don't have employers provide childcare because it takes money out of the system. Can you dig into that a little bit more and talk about how that works? And Anne, if you have content or commentary to add, I would love to hear your perspective on that as well.
I don't have a lot more detail other than that, that employers creating their own a child care center of their own, that's only for their employees. One, I think there are a lot of barriers to them doing that. I don't think they understand the complexity of the regulations around childcare, and a lot of times they can't even make it work. But two, I think that it was partly an economies of scale thing, that those dollars, if there are dollars there to help, fully funding some helping the existing child care providers have the volume that they need and the revenue that they need, might be a better use of the funding than standing up multiple employer-based systems. So I know Jefferson Healthcare in Jefferson County in our region was very, very concerned about the child care issue specifically for their employees, but they ended up partnering with YMCA to create a facility that's going to be open for everyone, and it's a partnership that involves multiple partners, and is standing up some additional child care availability for the whole community. So I'm sure Anne has a lot more that could be said about this, and a much deeper understanding than what I was able to get in a couple conversations with folks.
Yeah, Karen, I would just kind of affirm everything you've said is something that we hear across the country. I think employers, for a number of reasons, assume that if they're going to support childcare as a benefit for their employees, it has to be an on-site childcare center, which raises a number of logistical and cost challenges, and sometimes is not even what employees really want. So I think there's education to be done that a lot of the limited incentives for employers that exist right now in our tax code also apply when they subsidize slots in existing childcare providers programs, and that those partnerships can be kind of mutually beneficial. I think like recent incentives in the CHIPS Act for employers to have childcare are inclusive of those partnerships, with both family home-based childcare providers and centers, as well as those providing on-site. I think there's a big education problem there, but employer-sponsored care can't be the only solution. I don't think we want childcare to be a benefit tied to employment necessarily, but it is an important support source of resources in some communities. Happy to add anything else that would be relevant to this conversation, but I think that those problems with employer sponsored care and not getting off the ground, being under enrolled, being seen as a threat to existing childcare providers are something, or conversations that are happening across the country.
Yeah, that context is really helpful, both the specific example that you provided, Karen, and also some of the all solutions on the table ideas that you're sharing, Anne. Um, I'd like to hear where you all think there is positive momentum, if you have examples of that, around policy solutions that can really unlock some of these challenges for rural community and economic development. Um, if is it an organization? Is it particular legislators who are great economic development champions? Is it another place where you're seeing momentum? And if uh, question 1.b, who is in those agenda building conversations and who might be missing? I've heard you already mention childcare providers and people in the childcare ecosystem needing to be at the economic development table. Um, who else should we be making sure that we lift up the voices of in this conversation?
Well, I'll start. I think our field, as you might have seen in headlines in the national news, recently went over the child care cliff. This idea that the investment made through the federal Rescue Act, those funds are that have supported childcare over the last 2 years are expiring, and in some states, ended quite abruptly at the end of September. Other states had obligated them a long time ago. Um, so I think it is a time where a lot of people in my field are feeling a little pessimistic. But I will be the voice of optimism for a minute. I think that there are a significant number of states that have made tremendous investments over the course of the last few years that can serve as examples for federal policy. So, New Mexico, Vermont, Illinois, Minnesota, Oregon, Washington, D.C. I'm sure I'm leaving out some really critical ones, but we, over the next few years, are going to enter into a national experiment where we learn a whole lot more about what the investment of billions of dollars can do to childcare supply in a state, and what the lack of investment means in other states. So I maybe it's just my nature, but I have optimism for for the learning that will come out of that, and the push towards deeper investment in this industry at the federal level that can come. I think the childcare field, through the experience of COVID-19, learned a lot about what childcare businesses need to sustain themselves, and there are rule changes coming related to funding. They're picking up momentum in different states related to funding the actual cost of childcare instead of the market price of childcare, providing specialized grant programs to contract for slots in rural communities. So I think that there's reason to be hopeful, and that we can look to some of those states that are leading the way, and the impact that those investments are having to make the case in other communities, in other states, and of course at the federal level.
I can say some things in terms of some policies that I think are helpful. Kind of across the federal government right now, the Justice 40 initiative and the emphasis on equity that has been introduced into the grant guidelines of pretty much every federal program is I'm not sure that it's going to ultimately be successful, but it's a lever. It's a way to say to people, to economic development folks, who might not have been inclusive and might not have brought certain people into the conversation that, wait a minute, you can't get grant dollars unless you do this. And in a lot of cases, just lip service won't be enough. You know, that there actually has you actually have to be able to show that there will be real benefits and that there is real collaboration. And so I do think that that should that continue, that could be really helpful. Also, you know, the Economic Development Administration, which is kind of they're one of our primary funders. You know, they require economic development districts every 5 years to do a comprehensive economic development strategy for the region. They now are requiring that you address climate change and equity in your plan, and that's new. And it was already in our plan, but it was not. It is not mostly the case that that's addressed at all. And so by making that an explicit requirement, you know, it starts to shift the lens a little bit. Whether these things will ultimately, you know, have major impact, I don't know, but it's really, it is an opportunity to really change the conversation and to change who's in the room and to get funding to, you know, areas that really need it. The challenge with a lot of this is that even though a lot of the programs that have been developed are supposedly, you know, low barrier, easy to apply for, that's often not actually the case. You know, it really requires some level of sophistication, some level of paid staffing, some level of grant writing and management experience in order to apply for this funding, get it, and manage it. And you know, I think we're still leaving behind a lot of the most distressed urban communities and the most distressed rural communities. And you know, I grew up in the South, and you know, there's a lot of the small majority Black communities in the South. You know, suffer from a lot of the things we've talked about: the low tax base, the lack of infrastructure. There is a real opportunity here for them to get money to really transform. Same thing's true for other rural communities and for distressed urban communities. But if you know, if you have you know, one half-time staff person for your community, you know, how you're supposed to access this funding is a real challenge. And even where there is some technical assistance available, it's so limited as to be not very helpful. I don't have solutions for that. Intermediary organizations can help. They can also be exploitive. You know, it's a real challenge. But I'm hopeful that at least we're having that conversation, and at least it's being written into policy.
What about you, Jacob? What comments do you have around where there's momentum building or folks who need to be um, who need to have more voice at the table?
Yeah, I think that one of the things that we've seen momentum around is growing recognition that the crises of homelessness and um, drug use and behavioral health issues often have, like, at the core, a housing problem and should not be met with criminal justice response. I think that's like one of the big things that came out of the 2020 racial reckoning and the sort of like awareness that has been sort of expanded. And you know, I think we see movement across the country around that still, even now. And I think that some of the voices we've heard um, that are most involved with those issues, really one of the things they speak on is the importance that, like, having a recognition that returning to drug use is a normal and expected part of recovery from substance use disorder, and it should not be criminalized, and it should not lead to someone losing access to housing or access to treatment or community-based treatment particularly. And so I think that that's like something that we would love to see sort of more institutionalization around that, such that like programs don't have strict sobriety requirements, that don't match with the best evidence about what real recovery looks like. And I think that from an economic development perspective, one of the key things in workforce investment and workforce development is like helping people kind of stay in the workforce and helping them do that. And criminalizing someone's like attempts at recovery is like a very disruptive way to like respond to behavioral health issues and like causes workforce problems, definitely. So yeah, and that's something I would speak to.
Yeah, and I can just lift up that there are a number of pieces of legislation that are gaining traction right now on some of these supports recognition of the needs of people who are in substance use recovery. I think some of them aren't getting as much traction, but one that we have endorsed is the Reentry Act. Has not yet been read on the floor, but that is linked to a few other bills that are attempting to make sure folks have access to Medicaid um, shortly before release from an incarcerated setting, and so that there isn't a disruption in treatment. So glad to hear you pointing to some momentum on that front, Jacob, and hopefully there are opportunities for us to accelerate the momentum there. As I started talking about pieces of legislation, are there specific either state or federal bills or programs that you all want to lift up and highlight at this stage that you think folks in our rural network should be aware of and are opportunities for advocacy? I heard you mention, and that there are several state models around funding for childcare, and I'm looking forward to hearing a little bit more about that in follow-up. But if there's anything you want to highlight here in this recording, I would love to hear it outside of childcare as well. What would you want to elevate for our network?
Hi, I'm sorry. I think my internet has been a little bit of a problem, but if you can hear me, I will point out a couple, I think,
I can hear you.
exciting, wonderful, thank you. A couple exciting state initiatives. I think that a really key piece, as I mentioned, is shifting how states think about their childcare subsidy programs from being a voucher that pays after a child receives care at an amount that aims to replicate the private market to a pre-funded contract with programs that is shaped by data collection about what it actually costs to provide childcare and what it costs to do that in a context where people are making at least a living wage, if not more. So a number of states, with New Mexico really leading the way on that, have shifted to that kind of cost model approach. And what we see in states that do that is that in-home providers and rural providers and providers who are offering care to infants and toddlers are the ones that see the largest difference in how they're compensated, because those are the areas of our sector that were previously operating at those significant losses and really underfunded. So I think that that's really exciting. We also see a number of examples of direct supports to the childcare workforce, which I think is really important to elevate, with kind of Washington, D.C., which is, of course, a unique and not very rural context, really leading the way on providing significant funding directly to the childcare workforce to ensure that they're earning a living wage. And I think some sort of cost sharing is going to be really necessary to address some of the dynamics that Karen mentioned, that we're asking for people to have advanced qualifications and a lot of experience, and then competing with K-12 education and a number of other industries that are able to provide significantly higher wages than the childcare field is right now. I think that those are kind of like broadly exciting programs and initiatives in states, but have the potential to really transform rural childcare, where that difference between what families are able to afford and what it costs to provide care can be most extreme, and where the workforce shortage can create really, really challenging hiring dynamics for programs. I think, again, I just would emphasize that state programs that are working with family child care providers, in-home providers, to provide quality care, to provide universal preschool, are going to be, I think, more successful in maintaining infant toddler care and providing services in rural areas than states that are, whether explicitly or just with a lack of support, excluding home-based childcare programs from various offerings. I think my internet's a little better now.
Thanks. And do we still have you there? Maybe we. Hopefully we still have you. I think we got your comments, and I'm really grateful for you sharing those specific examples. I'm interested in hearing from Jacob and Karen also on this issue of what are the programs or bills that are currently introduced at the federal level or a state level that you think deserve the attention of our network.
So I'm not as heavily involved with the policy work on my team as in my role as a researcher, so I can't speak to some, you know, legislation basically. Like I think that that's something I could maybe talk to somebody else and get back to you on. But one of the programs or the sort of innovations that I've seen that I think has recently been developed is um, through some work that's happening in Eastern Kentucky and Appalachia, where they're using a navigator approach, sort of a peer navigator that is like helping people as they are released from jail to access social services, get ID, get the kind of things that people need upon release from jail. And so far, we're seeing great results from that. It's sort of like an investment in a community that doesn't have a lot of kind of help in accessing social supports, but has a lot of need. And so I think that like those kinds of like low cost ways to expand access to the already publicly available social services that do exist, I think could be like a very useful model that we'd like to see replicated elsewhere if this promising kind of program proves effective. So it's something I would point to.
I think those examples are worth their weight in gold for programs that can deliver a return on investment. So thank you for sharing that example. All right, Karen.
Well, I guess I would echo what Jacob just said. That's actually one of the things that we wrote into our Recompete grant is a navigator system that is more comprehensive than what we currently have, where the navigators would be employed by the county and it would be kind of a combination of a traditional navigator and case management, so that one navigator would stay with a person and link them up to kind of everything that they needed. And that concept is coming out of a couple of things. One is that someone who's working in our human services agency locally has recently been hired. Actually, worked on a formerly incarcerated navigator system in an urban area before coming to our area, and was just super impressed with the effectiveness, and so has been a proponent of that. But the other thing was, again, looking at our childcare statistics, realizing, based on some survey results, that only a tiny proportion of the people who are eligible for childcare subsidy were getting them, and so no one was making them aware that they were eligible for that, or helping them apply for it. And there clearly is a need to help people access what they're already eligible for, and that can make a tremendous difference in people's lives. So I do think that that kind of program can be really helpful, and that we know that just giving a referral, oh, go talk to so and so at this agency, the chances that someone actually makes it from door A to door B without getting frustrated, it's just really hard to navigate everything. So I think I would agree with that recommendation. Also, we don't follow legislation a whole lot. It's just not something that we have a lot of time for. But Annie, the bill that you sent out, that has USDA having a capacity building program with kind of 5 years of funding, I think that would be a terrific model, because that's kind of what we really need. I think, we did apply for recompete funding, and I think recompete could be transformative for the communities that get it, but that's a small number of communities that are going to get it, and it's still pretty targeted. The kinds of activities that you can do with it, while it's flexible, it has to be targeted at high wages, and at getting a particular population into jobs. Capacity building funding that could be used a lot more flexibly and kind of where it's needed the most, I think could be tremendously helpful for a lot of communities. So I don't know if you wanted to speak a little bit about that, Bill.
Yeah, I'm happy to add a little bit of context there, and I want to make sure I leave a little time at the end for you all to kind of summarize your thoughts. The recompete, sorry, I'm saying the wrong one. The Rebuild Rural America Act is the bill that Karen is talking about, and one of the things we really like about that is that it's a block grant structure, so that it's an entitlement. Folks get access to that funding automatically rather than needing to compete for it, which we think is really important to address what you mentioned, Karen, which is recompete has some structure that we like, but at the end of the day, it's only going to be a handful of communities that are able to access that funding. And we really believe that rural communities deserve the access to the tax dollars that are meant to help every community thrive. And so we like that block grant structure. And the longer time horizons for implementing economic development solutions, which we know that many communities need longer time horizons, but rural communities in particular do. And then another element of it is that it does have that flexible approach to economic development, which allows communities to do some analysis and assessment of what their individual communities need, and then put the investments into that, including that social infrastructure that we've been talking about a lot on this call. So it sort of removes some of those negative incentives that we've talked about together, to put money into what the funding is already available for, even though it may not pencil out and it may not lead to long-term economic thriving, but that's what is currently available. So we really like that opportunity. It is currently introduced by Senator Gillibrand in the Senate and Representative Budzinski in the House as a marker bill for the Farm Bill. So that's just something to put in the back of your minds as practitioners and researchers that who may not be doing as much with policy, but if there is some advocacy in your future, we think that this is one of the good ones. As we wrap up our time together, I know that this is like the biggest and hardest question I'm going to ask of you, but if you had to try to summarize in 30 seconds or less what you think what is a policy goal for rural economic development that you think could really address some of the disparities and inequities that we currently face? What would be that single biggest policy goal that you would ask the advocacy community and rural advocates to get behind? They don't have to match, and I won't hold you to this if you decide that it should be something different later, but just as a way of summarizing your thoughts from today, what should people take away from this conversation?
Um, I think one of the things that is really central for rural economic development and rural communities is the vision of investing in the people that live there and not, things like jails and prisons. And um, I think the policies that we'd like to see around that are like a recognition that it's been too easy for too long to get money to um, build jails and prisons in rural communities, but it's been hard to get money to run programs that meet people's needs and to help people's needs like housing or childcare or behavioral health. And so we'd love to see more investment in rural communities that helps people reach their full potential.
For me, I think one of the lessons that comes out of the pandemic is that block grants really work. The ARPA and CARES dollars that went to communities. For the most part, communities did really, really good things with those dollars. And so I do think that shifting our funding model to relying so much on a property tax base, and instead, having something like ARPA or CARES, where communities know that they're going to get a certain amount of funding, they know what the rules are for it, there's minimal reporting required, and they can choose what to invest in. Um, I know our communities did a really great job of putting together pretty inclusive task forces that made decisions about how to invest those dollars, and some really great stuff happened with the money. And so I think that our communities have demonstrated that if we're given money without a huge number of strings attached to it, we can do good things with it. We will do good things with it, and that rural communities should be trusted uh, to have funding to put where we need it to go to meet our needs, because our communities are just really different, and we don't all need the same things, and these sort of one size fit all programs with huge matching requirements just don't really work for most communities.
Thanks, Karen.
I
How
love
about
that,
you,
Karen.
Aaron?
And I think yeah, I was just going to say, I think Karen's story of pulling in the YMCA at the very last minute in a planning process and it shifting the way the proposal supported childcare writ large really speaks to just the need to pull parents, families, and childcare providers into the table and have the time and the funding to be able to do thoughtful planning together. I think, as we've discussed throughout this conversation, the needs of rural communities vary based on a number of factors. And I think that it's not easy to engage busy working parents or childcare providers who are, especially in home providers, often offering 65 hours plus of childcare a day or a week. But providing interpretation, providing engagement opportunities during nap time and evenings and weekends. I think just having that conversation is kind of where we're at, and making sure that economic development advances the childcare field that already exists, rather than kind of making assumptions about what's needed that doesn't actually meet the needs of families. So that would be, I hope that doesn't feel unambitious, but I think that comes first before I could name a specific policy.
I'm really glad that you elevated this because it's a theme, in fact, from the conversations that we've been having, where having more robust grassroots engagement and having folks at the table for setting agendas and designing policies is a gap in a lot of the solutions that are being proposed. So you're in good company in suggesting that one of the big policy goals we need to advance is creating that policy with more robust engagement. So thanks for elevating that. I think that it's really important. I know that we are over the time that you committed to, so I want to be thoughtful about that and let you go. Thank you all so much for your time today. Thank you for coming to this conversation with candor and getting to know one another. I will follow up with each of you with some next steps, and thank you so much for your expert contributions.
Thank you all.
Thank you. It
Bye.
was nice
Bye.
meeting you all.
All right. Bye, Karen. I will follow up with you very soon.